Nursing Healthcare Issue, Nurse-to-Patient Ratios and How It Affects the Patients and the Staff by Darla Cutsinger. Hospitals are challenged to provide nurse staffing levels adequate to ensure patient safety while maintaining reasonable costs. The association between nurse staffing and patient outcomes has been of interest. Nurse staffing has been correlated, for example, with falls, nosocomial infections, and various complications linked more specifically to nursing care. The nurse's workload variation is patient need, which fluctuates daily and varies between units. It depends mainly on the patient-to-nurse ratio, which changes with patient turnover, such as admissions, discharges, and transfers between units. Patient turnovers affect nurse workload not only in terms of patient numbers, but also regarding the task associated with each admission and discharge. Both high patient turnover and high patient-to-nurse ratios are linked to a higher likelihood of hospital-related mortality. Appropriate nurse staffing levels are crucial to optimize the quality of patient care, improve care outcomes, sustain the nursing workforce, and improve the work environment. The Nurse Staffing Think Tank is a diverse group of frontline nurses, nursing leaders, and other key stakeholders, including patient safety representatives, CEO, CFO, and human resources. They have published a set of priorities and recommendations that provide immediate strategies that can be feasible in short term, such as 12 to 18 months, to help address the nurse staffing crisis. The think tank was launched by Partners for Nurse Staffing, a collaboration between the American Association of Critical Care Nurses, American Nurses Association, American Organization for the Nursing Leadership, Healthcare Financial Management Association, and the Institute for Healthcare Improvement. As stated by an AACN president, Beth Wathen, MSN RN, CCRN, healthcare is a human business. Hospitals can add all the rooms, bed, and equipment they want, but none of that matters without the nurses there to take care of sick patients. For years, usual and accepted staffing models have viewed nursing as an expense, not an investment. And yet, there is ample evidence that links appropriate nursing staffing with optimized nursing care and improved patient outcomes. Understanding the barriers and facilitators could assist in making the transition from nurse-to-patient ratios to workload intensity staffing easier. I have found by considering patient acuity along with the use of the modified warning score, or the MUSE scores, when considering making nursing assignments helps equal out nurse-to-patient staffing ratios. This study directly evaluated whether patient-to-nurse staffing ratios were associated with clinical outcomes for patients admitted with sepsis in 116 New York State hospitals. The researchers in this study simultaneously evaluated the effects of hospital adherence to the SEP1 evidence-based care bundle on patient outcomes to determine whether and to what extent improving patient-to-nurse staffing ratios might benefit patients. They found that every additional patient in a nurse's workload is associated with higher odds of death and as well as higher odds of readmission and longer lengths of stays, which suggests attention to patient-nurse staffing ratios may be critical to increasing adherence to sepsis care and improving patient outcomes. A longitudinal panel data set was developed from 138 VA acute care hospitals, 2 university institutional review boards, and a local VA research and development committee approved the study. In a comprehensive systematic review of patient and employee outcomes on off shifts such as nights and weekends, researchers found that both patient and employee outcomes were worse off on off shifts than on more regular hours. Adequacy of nurse staffing is a key variable associated with patient safety. Better nurse staffing at night relative to the day shift was associated with shorter length of stays. In this case study, retrospective registry data was collected from 20 of the 27 somatic illness inpatient units at a university hospital in Finland as a monthly time series over a 1-year period. This study showed that nursing staff ratios make a difference in the length of stay for the patient. These subgroups using the structured outcome model help outline the correct nurse-to-patient ratio. This study was conducted in the Kingdom of Saudi Arabia. The current study's findings are consistent with other studies conducted elsewhere, where nurses on night shift rotations face substantial stress, which might affect their performance. Hospitals and nursing services run 24 hours a day. 12-hour shift rotations are very common worldwide, but there are growing concern about its impact on care quality and patient safety. Night shift is already at a higher risk for potential poor outcomes. Adding higher to nurse-patient ratios make a substantial impact not only to the nurses but to the patients as well. Higher nurse-to-patient ratios, particularly at night, can negatively impact patient outcomes. Studies show that inadequate staffing is linked to increased mortality rates, longer hospital stays, premature patient discharges, higher readmission rates, delayed treatment, reduced patient satisfaction, and increased risk of adverse events. This is because nurses with higher patient loads may have less time for individual patient needs, potentially leading to missed care, delayed responses, and increased errors. While night shifts often have lower staffing levels, the impact on patient outcomes can be significant. Higher to nurse-patient ratios at night can lead to increased mortality, longer stays, and a higher risk of adverse events. It's important to remember that balanced workloads and proportionate staffing ratios are crucial for improving patient safety and well-being on all shifts, providing a secure environment for the patients. Nurse-to-patient ratios are crucial for the fact that they directly impact the quality and safety of patient care. Correct ratios help improve the well-being of nurses as well. Studies I have conveyed consistently demonstrate that adequate staffing leads to lower ratios, resulting in improved patient outcomes, reduced medical errors, and greater nurse job satisfaction. Safe nurse staffing means that an appropriate number of nurses available to care for patients with the right education, skills, and experience to ensure that patient care needs are met. Furthermore, the working conditions and environment must also support staff to provide optimum care. If nurses have a larger team, they can distribute the mental, emotional, and physical demands of their daily tasks by allowing for appropriate breaks and the ability to seek support from additional staff. By doing so, patients interact with a team of nurses who can evenly distribute critical care tasks and subsequently deliver significantly better patient care. Nurse-to-patient ratios are crucial for the fact that they directly impact the quality and safety of patients. Correct ratios help improve the well-being of nurses. The studies and facts I have conveyed to you in this presentation consistently demonstrate that adequate staffing leads to lower ratios, resulting in improved patient outcomes, reduced medical errors, and greater nurse job satisfaction. Nurses need to have facilities implement lower to nurse-patient ratios, not only for the patients, but for the nurse as well.